Body dysmorphic disorder represents one of the most misunderstood and underdiagnosed mental health conditions affecting millions of individuals worldwide. This complex psychological disorder goes far beyond typical concerns about appearance, manifesting as an obsessive preoccupation with perceived flaws or defects in one's physical appearance that are either minor or completely imaginary to others. The condition creates a distorted mirror through which sufferers view themselves, transforming normal self-reflection into a torturous experience of self-criticism and shame. The origins of body dysmorphic disorder often trace back to adolescence, a period when individuals naturally become more aware of their physical appearance and social acceptance. However, for those developing this condition, normal teenage concerns about looks escalate into consuming obsessions that interfere with daily functioning. The disorder affects people of all genders, ages, and backgrounds, though it frequently begins during the vulnerable teenage years when identity formation and peer acceptance feel paramount. Research suggests that approximately 2% of the population struggles with body dysmorphic disorder, though many cases remain undiagnosed due to the secretive nature of the condition and the shame surrounding it. Individuals with body dysmorphic disorder typically focus their concerns on specific areas of their body, most commonly the face, hair, skin, nose, or other facial features. However, any body part can become the subject of obsessive attention, including genitals, breasts, muscles, or overall body size and shape. The perceived flaws become magnified in the person's mind, creating a distorted self-image that bears little resemblance to reality. This distortion is not simply vanity or narcissism. It represents a genuine perceptual problem where the brain processes visual information about one's own appearance in a fundamentally altered way. The daily experience of someone with body dysmorphic disorder involves repetitive behaviors and mental rituals designed to check, hide, or fix their perceived flaws. These behaviors might include excessive mirror checking, spending hours applying makeup or styling hair, seeking reassurance from others about their appearance, or conversely, avoiding mirrors and reflective surfaces entirely. Some individuals engage in elaborate grooming routines that can consume several hours each day, while others might undergo multiple cosmetic procedures in futile attempts to correct their perceived defects. The irony is that these corrective efforts rarely provide lasting relief, as the underlying perceptual distortion remains unchanged. The psychological mechanisms underlying body dysmorphic disorder involve complex interactions between genetic predisposition, neurobiological factors, and environmental influences. Brain imaging studies have revealed differences in how individuals with the condition process visual information, particularly regarding faces and details. There appears to be an overactivation of brain regions responsible for detailed visual processing, combined with reduced activity in areas that integrate information into a cohesive whole. This neurobiological pattern may explain why people with body dysmorphic disorder become fixated on minor details while losing sight of their overall appearance. Social and cultural factors also play significant roles in the development and maintenance of body dysmorphic disorder. Our society's emphasis on physical appearance, amplified by social media and digital manipulation of images, creates an environment where appearance-related concerns can flourish. The constant exposure to idealized and often unrealistic beauty standards through media channels provides fertile ground for the development of distorted body image. Young people, in particular, are vulnerable to these influences during critical developmental periods when self-esteem and identity are still forming. The impact of body dysmorphic disorder extends far beyond appearance concerns, affecting virtually every aspect of an individual's life. Educational and occupational functioning often suffer as the time spent on appearance-related behaviors interferes with responsibilities and commitments. Social relationships become strained as individuals may avoid social situations, cancel plans due to bad appearance days, or seek constant reassurance from friends and family members. The condition frequently co-occurs with depression, anxiety disorders, and obsessive-compulsive disorder, creating a complex web of psychological challenges that require comprehensive treatment approaches. Treatment for body dysmorphic disorder typically involves a combination of cognitive behavioral therapy and, in some cases, medication. Cognitive behavioral therapy helps individuals identify and challenge distorted thought patterns about their appearance while developing healthier coping strategies. Exposure and response prevention techniques, borrowed from obsessive-compulsive disorder treatment, help reduce compulsive behaviors like mirror checking and excessive grooming. Medications, particularly selective serotonin reuptake inhibitors, can help reduce the obsessive thoughts and compulsive behaviors associated with the condition. The journey toward recovery from body dysmorphic disorder requires patience, professional support, and often the involvement of family members and friends. Education about the condition helps both sufferers and their support systems understand that the concerns are not simply vanity or attention-seeking behavior, but represent genuine psychological distress. Recovery involves learning to see oneself more realistically, developing a healthier relationship with mirrors and self-reflection, and gradually reducing the time and energy devoted to appearance-related concerns. Prevention efforts focus on promoting media literacy, encouraging realistic beauty standards, and fostering environments where individuals are valued for qualities beyond physical appearance. Early intervention is crucial, as body dysmorphic disorder tends to worsen over time without appropriate treatment. Healthcare providers, educators, and family members must remain vigilant for signs of the condition, particularly in adolescents and young adults who may be reluctant to seek help due to shame or embarrassment. Understanding body dysmorphic disorder requires recognizing it as a legitimate medical condition that deserves compassion and professional treatment. The suffering experienced by individuals with this disorder is real and significant, despite the fact that their concerns may seem trivial to others. By increasing awareness, reducing stigma, and improving access to appropriate treatment, we can help those affected by body dysmorphic disorder reclaim their lives and develop a healthier relationship with their bodies and themselves. The path to recovery is possible with proper support, understanding, and evidence-based treatment approaches that address both the psychological and social aspects of this complex condition.